Welcome to the Spinal Chat Podcast, a service of the Pennsylvania Chiropractic Association. In today's episode, PCA Executive Director Mike Barba speaks with Joe Kryszak, President of Stirling Professional CBD, a strategic business partner of the PCA. Stirling Professional is a trusted leader in high-quality, clinical-grade CBD products designed specifically for healthcare professionals. Through this partnership, PCA members receive exclusive discounts and access to resources that can help integrate CBD safely and effectively into chiropractic practice. Together, Mike and Joe explore the science, quality standards, and practical uses of CBD in chiropractic care, as well as how this partnership is helping doctors enhance patient outcomes and diversify their practice offerings. Now here's Mike Barba.
Hi everyone, I'm Mike Barba. I'm the Executive Director of the Pennsylvania Chiropractic Association. Today it's my privilege to have the person who I had as my first infomercial, Stirling Professional, Joe Kryszak, and I'm having him back to talk about the benefits of Stirling Professional, the CBD brand, this company. The reason why the PCA chose to work with Stirling specifically is because Stirling really takes the responsibility of purity. I'm excited about introducing you all to Joe again and to talk about his product and talk about the services that he can offer. So, Joe, thanks for being here.
Hey, pleasure. Thanks. Always great to talk to the PCA. Great organization, great members. Super excited to talk to you a little bit about our business, where we're going, some new products that we're going up, and really hit home on how we are managing and working with doctors across the nation.
Joe, let's talk about CBD, why it's important within chiropractic offices as a use study, and why Stirling Professional is different from the other brands that are out there.
So why I think CBD and chiropractors is the perfect alignment between two industries for a number of reasons. Number one is because chiropractors believe in helping the body heal itself naturally. That's exactly what CBD does, working through the endocannabinoid system. The Harvard Medical School says the endocannabinoid system is the most important system in your body to maintain homeostasis. It allows organs and cells to talk to each other. Great research, great proof that it does three main things. Number one, reduce pain and inflammation. Number two, it helps people relax so they can fall asleep better. And number three, it helps with stress. All three critical areas that are affecting society and the health of humans. And got some great articles. So I've written, in the last 3 years, I've written 24 articles for Chiropractic Economics. I think it's not good enough just to sell a great product at a great price. Education is key, because there's a lot of confusion out there on CBD, what it doesn't do. Is it a miracle cure? Does it solve every issue that humans have? Absolutely not. But it has some great benefits. And what chiropractors do, and successful chiropractors do, is they incorporate it into a path to help their patients during treatment and between treatments feel better, sleep better, and reduce their pain and inflammation. There are a lot of CBD companies out there, right? So there was a lot of bandwagons that jumped on in 2018 when CBD became legal. But Stirling does a number of things differently. Number one, we sell just to professional offices. So you can't go online and buy Stirling products off our website. We sell solely to professional offices. Of those professional offices, it's 90, probably 95% chiropractors. We do sell to some massage therapists also, but mainly to chiropractors, because we call ourselves medical grade CBD. Medical grade CBD is not offered to the public. It's offered just to patients of professional offices. Why do we call ourselves medical grade? Anyone can call themselves medical grade, right? It's a nomenclature. But what we do is four things that prove we're medical grade. Number one, robust third-party testing. So we have on each one of our products, we have a QR code. That QR code goes to independent third-party testing. So it tests not only for THC and CBD content, but it also tests for mycotoxins, heavy metals, pesticides, and fungi. Because the hemp plant grows amazingly fast, it brings in nutrients from the soil, both good nutrients and potential toxins. So we test so you know that with Stirling you're getting the purest CBD. It's not just Joe Kryszak saying you get the pure CBD. Independent third-party testing proves it. Number two, we have a process called solventless extraction. We don't use ethanol or CO2 to extract the trichomes off the hemp plant. We're literally using air and water, getting the purest compounds out there without no harsh chemicals. Number three, because of our extraction particle size, very small nanotechnology. And then number four, we really pride ourselves on the education of bringing the knowledge and resources to chiropractors and their staffs, right? The staffs are where the magic happens when the staffs are trained, because then they can talk intelligently to patients on what makes Stirling different and how it can help out, their patients.
Yeah, it's interesting. The PCA has been working a lot with trying to get all staff members at chiropractic offices to become members of the PCA. We're giving away free memberships for that specifically because we know that a good practice only is successful if it's got a good staff working hard for it and really advocating on behalf. Can we talk a little bit more about the education side? So you're a doctor who brings the Stirling CBD brand in. You have it as a product in your room. You recommend it to your patients. If somebody has misgivings, what would you say to them in regards to why CBD is going to be effective for them and why trying it at least once it'll be effective? And actually, I have a quick little story, and we haven't actually talked about this yet, but we had our conference recently, a Northeast Chiro Summit recently, and I brought the wrong shoes. And I got to tell you, my feet were just killing me at the end of the day, the first day. So I'd gone by your booth and I got a sample of the balm and I lathered my feet up with that. And I got to tell you, the next day, it was as if I didn't walk the day before. It was incredible. And if that's a case study or use study, that's certainly already a fan of your product. I'm a fan of obviously the balm and what have you, but it really saved my feet that next day. So thank you for that. And thank you for the
That's cool. I love those stories.
So let's get back to that. Can you tell me how you would educate a patient if they were asking you directly, or how a doc should educate or a staff on why try this? Why give this a shot?
Give it a shot for three reasons. Number one, because with our products, so whenever somebody brings in our products, we're going to give samples to them, free samples to hand out to them, because the magnesium balm that you used, our products have no masking agents, right? There's no lidocaine or nothing in there that hides the pain. So all the pain relief that you felt in your foot was due to reduction of inflammation, right? So it has the particular one is our magnesium balm. That's our one of our best sellers. Got magnesium from Dead Sea salt, arnica, eucalyptus, cinnamon, clove. Smells great, goes on easy. Number one, what's a great proof point? Number one, try it out. Number two, why would it be considered for chiropractors? If you look at our products, you look at our pricing, we are actually able to resell. You're actually able to sell products for a lower price, better products, medical grade products, cheaper than the gas station or the dispensary or the vape shop up the street. Our pricing is phenomenal. The one thing I learned when I was working at Amazon years ago, I don't want to sell one thing at 100% profit. I want to sell five things at 50% profit. Our pricing is amazing. Anyone who wants to do a price compare between our products and anyone else, be glad to show the details of it, because I believe that this is just such a great product. It should be out in the masses. And then number three, because once again, it helps your patients feel better during and between treatments. And again, it's not just me, it's all the research, all the studies, Harvard, Mayo Clinic, Cleveland Clinic, Johns Hopkins, great research that talks about how CBD works and the effectiveness of it. I want to be clear though, one of my competitors I see are the vape shops, are the high dose THC. I don't believe in high dose THC, right? I don't believe in that stuff, not in the medical establishment. So like all of our lotions have no THC in it. Those products are not designed to get you high. The only products that have just a little bit of THC in it are sleep gummies, because there's great research that says a little bit of THC helps calm the brain down so you get good sleep. But I want to be super clear that our products we're not selling bong hits. We're selling super pure medical grade products that help the body naturally and work with the body's own endocannabinoid system. You have an endocannabinoid system. You literally have a system in your body named after the cannabis plant, which again, Harvard says is the number one system in your body to maintain homeostasis. I do want to get back to you because I love what you said about the staff and training the staff. Because when the staff is trained, when they're knowledgeable, when they use the products, when they believe in the products, that's where the magic happens. So with all of our doctors that come on board to Stirling, I totally recommend having an introductory training for the staff where we talk about the products, what are the indications, how is our products used. Every staff member who attends one of our trainings, we actually give a free product to them because if they try it, they're 100% going to recommend it when a patient walks in and they can talk articulately about the product.
I like that you call yourself medical grade. I like that you go through the expense of third-party testing. That's an added expense, but that level of purity, I think, speaks to not only your faith in your product, but your faith in the process and extracting the product to ensure that it is the highest and safest quality. I know you talk about the third-party review, but way that you extract the CBD, and I might not be using the appropriate term, but extract the elements, that is a little bit different than, I think, the norm. Can you elaborate on that?
Yeah, so we are the only company that I'm aware of, and we do a lot of research that does what we call solventless extraction. So all of our competitors extract the cannabinoids off of the plant. The cannabinoids are where the CBD is, and it's sticky material. Snoop Dogg calls it the sticky icky, right? It's where the good stuff is on the plant. Competitors either use ethanol to extract the cannabinoids off. Ethanol, of course, is a terrible way to extract. It's very toxic to organic material. It breaks down the cannabinoids. So bad way to extract. Some use butane, a lot use CO2 to extract. They pump in supercritical CO2 into a compression chamber, which kind of melts the cannabinoids off. Lots of problems, lots of issues, very expensive thing to do. But we use solventless extraction. We put the cannabinoids in a huge vat of distilled ice water. What that does is it freezes the cannabinoids, the trichomes, so they're no longer sticky, they're crystallized. We put them through our system. We have an impeller going at 20,000 RPM, creating little micro bubbles. Those little micro bubbles hit the cannabinoids or the trichomes and blast them off. So you're getting the super, super pure product that's not decarbonized, that does not have harsh chemicals. And that's the reason why that we're able to get such pure product on there. And it's a process called cavitation. Doctors are very familiar with the term cavitation, but it is a huge differentiator for us and something that we're proud of to have this clean. We sell to doctors. We don't sell to gas stations up the street. And every product that a doctor brings into their office is a representation of them, and it's a representation of their office. And we need to earn that trust. So we need to go through the extra steps to ensure that we're building that trust with doctors. The way we do that is through the training, through the solventless extraction, any POP or merchandising materials that we have. Because once again, it's an honor to be in any office, and I need to make sure that I bring the trust and you can trust Stirling. The testing is important. The samples are important. The education is important. We want to make it easy for you. Selling you one time doesn't, and if it's sitting on your shelf, doesn't do me any good, doesn't do you any good. You just bought a bunch of products sitting on the shelf. We pride ourselves in helping the sell through. That's why the education, the training, the samples, the POP, merchandising materials are all part of the system to help you sell. Because guess what? Insurance isn't paying more. Reimbursements aren't being paid more. But if you sell five of magnesium balms a day, easy, that's an extra $55,000 a year in profit into your office. And when you give out a sample and when you use it on a patient during an adjustment, it is an easy sell because it works, because there's a true reduction in joint pain and arthritis and inflammation.
So I know from our conference, you have a very attractive display that you provide to offices. What comes with a standard starter package for someone who's trying to get into CBD?
Yeah, you have to A great way to increase profit is selling more product. But what you can't do, chiropractors aren't Walmart. You can't carry everything. I recommend just selling our 3 best-selling products, which are magnesium balm, muscle gel, and a sleep gummy. It comes on a really nice display. What I provide in the sample is 6 magnesium balms, 6 muscle gels, 6 sleep gummies, samples of each product on a really nice display. And then the POP merchandising material is all part of our starter pack. Because once again, easy selling the first time, magic happens when the repeat sells. So providing an all-encompassing package where chiropractors can buy in, got all the tools, all the training needed to get it sold through. And then once the system starts going, you start selling, patients are going to come to your office between visits to pick up product because they love it, it works for them, and can't buy it online. So it's like a win-win scenario.
If you have it in your office, you are the representative for that product, and that's where your sales lever comes from.
So there's a lot of companies, right? Some big lotion manufacturers have a history of starting off in chiropractic offices and then going into Walmarts or others. We actually did the opposite. We started off as a retail company selling direct, and then we started selling to chiropractors, and we're like, holy smoke, this is fantastic resource. And we shut down our commercials, our consumer side, because we're just selling through professional offices. So that's where we're hanging our hats. Is we're medical grade, so we have to be sold in a medical office.
Joe, as always, I enjoy our conversations because we get so much information. I think so much science-backed support for the product that you sell. I saw recently that you did an ad on a new product that you're carrying called Methylene Blue. Can you talk a little bit more about that and any new products that you'd like to highlight?
Yeah, the magic I have is not only great products at a great price. Really, one of the most important things I have, I talk to chiropractors literally all day. And chiropractors are not afraid to give feedback on new product that works. About 6 months ago, I started getting a lot of feedback from chiropractors on Methylene Blue. We did a bunch of research, great research. I could send you articles and links, the latest National Institute of Health on it. In February, we applied to get authorization to sell. There's 2 companies in the United States who sell pharmaceutical grade Methylene Blue. We started the process in February. They did a full probe of Stirling. What are your financials? Give me your tax receipts. Who are you selling to? Super excited that about 3 weeks ago, we finally got approval. So we're selling USA grade, USP Methylene Blue. Great research on it. It does a number of things in terms of mental cognition. One of the great things it does is it actually helps your hemoglobin it gives an electron to your hemoglobin, which allows it to carry around the oxygen more effectively through your body. So really cool.
The Methylene Blue really sounds like it's something that people might want to try. Anything that I think can affect us and help us with clarity, especially in today's day and age, is really an important product. Joe, I know you're a busy guy. Is there anything that you'd like the chiropractors of Pennsylvania to know before we go?
The thing I've learned working with chiropractors the last 7 years is you want to try something out before you sell it. I love chiropractors, their own guinea pig. They'll literally not sell something unless they try it out themselves. So if you want some samples, you want to test out any of our products, please let me know. I can send you some sample packs. I can send you some initial product at a discounted rate if you want to try the full products. I got to get this in your hands because it works. And I wouldn't give out samples if they didn't work. So number one, if you need anything, let me know. I'm here. And then number 2, I am very proud to be working with who I feel is the leaders of the healthcare industry in the United States, which are chiropractors. So thank you for all that you do. Thank you for how you improve your patients' health every day, and keep on making it happen. And proud to be a partner with PCA.
Joe, we're proud to have you as a partner as well. And I 100% agree. If you have doubts or if you've not tried it, and if it's not a part of your office, give it a shot. I think that in this particular case, taking it home and trying it yourself, you'll become a believer. And I think that you'll be able to convey that message to your patients. On behalf of the Pennsylvania Chiropractic Association, I'd like to thank Joe Kryszak. And I want to thank each and every one of you for being a member of the PCA. Thank you and have a wonderful day.
The PCA is proud to partner with innovative companies like Stirling Professional CBD, whose products and educational resources empower chiropractors to deliver more comprehensive, evidence-informed care to their patients. If your organization is interested in partnering with the Pennsylvania Chiropractic Association to support and strengthen the chiropractic profession, please reach out using the email link below. Thank you for listening to the Spinal Chat, a service of the Pennsylvania Chiropractic Association. To support the future of chiropractic in Pennsylvania, consider contacting your local legislators, contributing to the PCA PAC, and if you're not yet a member, joining the PCA today. If you enjoyed this episode, don't forget to like, share, and subscribe. You'll find links to upcoming webinars, membership resources, and the latest legislative updates in the show notes. Until next time, take care, stay informed, and keep advancing the future of chiropractic in Pennsylvania.